Hi, my name's Hayden Douglas, and I'm going to be doing a presentation on dietitians. All right. First off, what's a dietitian? Um, Dietitians are a vital aspect to collaborative care for clients. Um, they can work in a variety of healthcare settings, but with an acute care setting, they are in charge of nutritional related issues for clients. They're in charge of like assessing, coming up with nutritional plans, diet plans, things of that sort. Um, they really are important, especially in the acute care setting, because nutrition is so important in recovery. You know, whether it's a surgery, whether it's trauma, whether it's an illness, things of that sort, nutrition really plays a big role in client prognosis. Um, so, um, Before we kind of get into the nitty and gritty about what they do and how they work with nurses, I'm going to go ahead and just kind of go into their education. So, for their education, the basic, if you can see on there, um, the basic requirement is a bachelor's degree. Um, this is going to be a degree in dietetics or in nutritional science. Um, they also have an extensive um, training hours. So in order to get their degree, they have to complete over hundreds of hours of supervised clinical work, kind of like in order to get your RN, you have to have a certain hours of clinical experience as a student nurse. So they're very similar to a nurse in that aspect. So they have to have their bachelor's degree, and they have to complete a lot of hours of supervised work. Um, Similar to registered nurses, most states require that dietitians become registered for their state. Um, it's a RD degree instead of an RN, so a registered dietitian. They have to take a licensing exam for their state, much like a registered nurse. Um, some other things they can do actually is they can also get certified in a specialized area. So this could be like oncology. This could be in diabetes, pediatrics, things of that sort. So they're pretty similar in aspects to nurses with their certifications and education requirements and things of that sort. So I thought that was interesting. I also found a kind of a bar graph. You can see right there at the bottom. Um, it says here that over 90% of registered dietitians have their bachelor's degree. Um, so that just kind of shows you that the majority of dietitians just have that bachelor's degree to work. Um, Now they can also pursue higher education. So things they can do is pursue an advanced degree. Um, they can pursue, it's called a certified nutrition specialist. Sorry, I lost my place. Um, which can be given if they have their master's or doctorate degree. So they can become a clinical specialist when it comes to nutrition, which I thought was pretty cool. So after education, we're going to go ahead and go into 4 key job duties and kind of what they are. So the first one is going to be they monitor food service operations to ensure conformance to nutritional safety, sanitation, and quality standards. So basically, they're assessing just food operations. So they can work in hospitals, nursing homes, government agencies, cafeterias, and schools. So that just kind of shows you um, how important they are when it comes to assessing nutritional needs, especially in schools where children need certain nutrients, or nursing homes where, the elderly, what kind of nutritional needs do they need? Do they need extra protein in their diet to prevent, pressure ulcers, things of that sort. Um, they assess nutritional needs, diet restrictions, and current health plans to develop and implement dietary care plans and provide nutritional counseling. So basically, what that's saying is they basically assess clients per situation, and they will assess their nutritional needs, all the aspects of what happened to them and why, and then they go ahead and develop and implement a dietary care plan. So instead of a nursing care plan, they're doing dietary care plans for patients. How much protein do they need? How much carbohydrates do they need? If they can't ingest orally, are they doing, TPN? Are they doing PPN? Things of that sort. They advise patients and their families on nutritional principles, dietary plans, and diet modifications, food selection, and preparation. So I thought that was interesting because they're not only educating the clients, but they're also educating the families, much like a nurse. So they, whoever makes the most food in the family, whether it's mom, whether it's dad, whoever, they educate that person and say, hey, we need to have these types of foods. Why? Because of this, this, and this. Here's some recommended foods you can make. Here's some recipes, things of that sort. So I thought that was pretty interesting that it's not only the client, but they're doing their families as well. And lastly, they counsel individuals and groups on basic rules of good nutrition, healthy eating habits, and nutritional monitoring to improve their quality of life. So much like a nurse, they educate communities for health-centered care. So, in public health situations, where their diets may not be as good because they can't afford certain types of foods, or, what are some alternatives that they can do? Where are the resources at? What can they go to get better nutrition and, better general health, basically. So we went over a few job duties. What I thought was interesting is, so when they go with the nursing role, so dietitians and nursing, they kind of go hand in hand. So if a nurse kind of believes that there's a patient that's lacking in certain nutritional needs or things of that sort, they can call in a dietitian who can further provide, more complicated scenarios and plans that can help further help the patient to recovery. A lot of times the physician and registered nurses are seeking advice from dietitians, especially if they're on total parental nutrition, what should be in that? What should we be giving them if they can't ingest anything orally? So I thought that was really interesting that they're not only helping clients, but they're also advising nurses and physicians on best dietary intake for certain clients. The Institute of Medicine, before we end real quick, I just wanted to go over this. The Institute of Medicine found that nurses were convinced regarding the importance of diet in reducing heart disease risk. Many had substantial knowledge gaps and were not adequately prepared to counsel patients regarding diet and medication therapy for hyperlipidemia. So basically what the Institute of Medicine is saying is, although nurses feel confident in providing those educational needs for clients, sometimes their knowledge just isn't as extensive as a dietitian's. So they found that that dietitians spent significantly more time with the client on dietary needs compared to a nurse or a physician, and this is from the Institute of Medicine. So it just kind of tells you, how important they are as an educator. So we kind of went over a few different things for a dietitian. They can practice in several different settings, things of that sort. They can provide information on complicated needs and provide better foundation of nutritional care for clients. Nutrition is a vital aspect of patient care and can provide healing and a better prognosis for the client, which is ultimately the goal of every healthcare professional. Thank you.